to start. Good afternoon, everyone. My name is Maeve Fogarty, and I'm going to be your host for this afternoon's webinar. I am the Healthcare Development Manager. Also on the call with me today, delighted to announce that I have 3 members of the SD team, and you probably see them all below there. We have Janice Matthews, who is the Account Contract Manager. We have Sarah Murray, who's the Clinical Consultant. And we also have Ian Daniels, who's the Account Sales Executive. And also delighted to announce I have my colleague Anya Murphy on the call today, who's the Marketing Manager with Bunzl Cleaning Safety Supplies. So at this point, I'd like to extend a very warm welcome to you all. Thank you very much for taking time out of your busy schedules to join our webinar this afternoon. We're delighted to have you on board. I'm just going to give you a quick overview of how the session is going to run, and then we will start. So to begin the session, we are going to go to a video clip of a young gentleman called Jamie Gain, who shares an absolutely incredibly inspiring story about how he's dealt with his incontinence issues as a young guy. Then I will hand you over to Janice Matthews. Janice will take you through some really interesting slides about men's health and incontinence. And Janice will also take you through the product range, some great products we now have available for men on the market. And then I will hand over to Sarah Murray, and including the rest of the team will be on hand for you to partake in a questions and answer session at the end of our webinar event. You'll see by just hovering over the center of your screen, there'll be a bar that will appear. You can see on the right hand side, there's a small little Q&A box. If you hover over that, that'll give you the ability to open up a bar on the right hand side of your screen where you can type in any questions you'd like to put forward. And we'll invite those at a later stage. But without further ado, I'd like to go to the video clip. So thanks, Anya.
When I was about 9 years old, we were going around Disney World, and all of a sudden my feet collapsed from under me. They diagnosed me with a condition called plantar fasciitis, which is effectively just pain on the underside of the foot. And then after some different therapies, it was obvious that it wasn't working, so they kept trying new techniques until I had an operation. And the hope was then that that would stop the nerve that was supplying my foot, and therefore my foot wouldn't be in any pain. But instead what happened was that they cut the wrong nerve, and then I lost a lot of feeling from the waist down, which then led to continence issues. I didn't speak to anybody about it for so many years. I didn't really have anybody to talk to. I was in a hell of a lot of pain. My foot was purple, I couldn't stand on it. So from about the age of 16, I was adamant with the doctors that I wanted to have it amputated. And 6 years later, it was done. As soon as I had my amputation, I noticed a massive change in how much energy I had. I wasn't in any pain, I was medication free for the first time since the age of 9, and I just felt so much better. I could actually then start to recover. I could then look at getting a prosthetic leg. I think because I spent such a long time not being able to actually walk, now I'm able to run. It's just about continuing that journey. So I started judo once I could then hop again. I currently compete internationally, and I'm currently placed in the top 3 in the world, which is crazy. Coming up in about 6 weeks' time, I have the 24-hour endurance race, which is through mud, over obstacles, so anything from a 10-foot wall to a wall that comes towards you to an ice-cold bath. It's all about teamwork, camaraderie and working together. I just love it. As well as judo and obstacle course racing, I also do discus, javelin and shot put. Sport is my relax. Is it not relaxing? I think combining sport and continence issues is really quite difficult. I use TENA daily. So I was first introduced to TENA through my continence nurse, and actually we built up a connection over the coming months. And I was actually really inspired. Not many things inspired me, but I really was, about how open people were and how lovely people were. And I'd never really had an open conversation with strangers to start with about my continence issues, and it really gave me the motivation to be part of this TENA team. And it was really lovely to see everybody was on board, everybody was working towards this vision of making people's lives easier. I think 2024 Paralympics is a fantastic goal. I've got quite a few years to get there, so hopefully I will. But for me, I think I've always said Perseverance, perseverance, perseverance. That's always been the word that's kept me through my difficult times and keeping my head down and just keep going. But about 18 months ago, I kind of changed that slightly, and it's about appreciating the moment. And yeah, okay, some things aren't amazing sometimes, but actually we're in this amazing place and with my amazing cats in this amazing world. And as cheesy as it sounds, appreciate the moment, but just persevere through the difficulties.
Inspiring is probably an understatement, I would say. I'm sure you'll all agree. I'd now like to hand you over to Janice. Thank you very much, Janice.
Thank you, Anya. Can you see my screen okay? Yes, everything okay there?
Yeah, all good.
I want to take the next about 15 minutes to just talk about men's health. And when we started thinking about doing these webinars, we wanted to sort of break down the taboos and go straight into men's health, because usually it's more seen as a women's health issue, or maybe the women get more attention when it comes to the continence side. So because Men's Health Week has just passed us by there 2 to 3 weeks ago, and World Continence Week as well was just about 2.5 weeks ago, we wanted to look specifically at the male. Because we can't come out to you, we want to share just a few thoughts of how we can work in partnership with you, how we can help you, and some ideas. I've been working with TENA now for 10 years in Ireland, mainly in Northern Ireland. Some of you maybe know me. I've been to quite a few of your major hospitals, teaching hospitals in Dublin. So we're available on the ground. We just want to share what we can help you with. So now I'm just going on to the next slide. As you can see, this is live. Yep. There we go. The prevalence of continence issues. These are older slides that we've had for a while now, but they're roughly about 10 years old, but we're sort of, all our slides as well, sorry, are UK. We don't have any all Ireland figures at the moment, but generally speaking, 1 in 5, 1 in 6 of us at some stage in our life will develop some bladder or bowel issues, and 6.5 million of us have some bowel problems as well. And I work with both the children and the adult teams within Northern Ireland, so I see a lot of kids as well that suffer a lot from bladder and bowel dysfunction, and I want to share a few ideas of what we have seen and what maybe helps as well. I think we want to instill some hope as we start as well. The Royal College of Physicians, this has been bandied around for a long time, but 80% of continence issues can be treated. And this, to be honest, is actually directing your patient to the right service. And this makes all of the difference. And in fact, our services in the North generally audit their performance. And I'm going to refer to one of them. In 2017 and 2018, the South Eastern Trust were able to completely treat 92% of every client that walked through their doors. And their area would be above Belfast, and it's sort of like a wee residential area where everybody elderly seems to retire to. So they would have a lot of elderly patients here, but 92% of Angela's clients that come in and out here are treated. I asked her about the other 8%. They were sent on for surgical management or medical device or containment products. So we can do so much as nurses when we refer our patients. And I want to say, as a disclaimer, as a registered nurse as well, that continence is not normal. When we see continence issued, we need our GP or healthcare professionals to see that client. We need them referred to our continence nurse specialists, or urodynamics teams, or urology services, or our bowel services, bowel specialist nurses. And with all of that together, we can make such a difference to our patients. So so a lot of what we're seeing can actually be treated, and at the very least we can manage it better. And in the 10 years I've been with TENA, I've seen an awful lot. I've been out to a lot of homes. I've seen a lot of patients. I've had that privilege. I actually had the privilege of meeting and listening to Jamie. And Jamie developed a lot of problems when he was 14. And very typically in the male population, he kept it to himself for 3 years, and he sort of tried to manage it himself and spoke to a mate's mother who ended up being a nurse. And so he ended up eventually getting the correct referral for him. I suppose as nurses, everything that we do is based on evidence, and this is just some of the evidence I've taken out of one of our face-to-face modules. This is why we do what we do. This is why we are passionate about what we do, and the guidelines are ever evolving. And there's another booklet that I'll bring you on to as well. But everything we do is practice based, and it's based on good evidence. Interestingly, as we looked at the male urinary incontinence side of things, only 22% of our men with urinary incontinence will actually ask for help. And again, this is dependent on the type of patient, where they live, culture. We want to get access to more of these patients. And many years ago, if you go in and Google TENA men, TENA, and it'll bring you into YouTube. We did quite a few quirky type of videos, and it went on specifically to the male specific channels like car racing and football, to try and show that there was something we could do, that continence issues can be helped, and also some simple advice that our gentlemen could follow. So we've been trying to break these taboos for so long. So this is why we wanted to go in and look specifically at male issues. The International Continence Society, which is the leading body, describes male urinary incontinence as the involuntary loss of urine during the bladder storage phase, and there are many different reasons for this. How can continence affect our gentlemen? What we probably do know as nurses is, as we do get older, there are different conditions. It doesn't mean we can't treat it effectively, but 1 in 3 older gentlemen will have some bladder problems, and 12% of them may also have some fecal issues as well. The figures we're looking at are from the booklet I'm going to take you on, which was published last year. 5% of our 19 to 44-year-olds have some incontinence issues, 11% as we go into the 45 to 65 years. And once we're hitting the 65 years, there's close to 10%, I would say at least, of gentlemen that are experiencing some incontinence issues daily. The presentation would probably be different. If this was ladies, you'd be looking at the stress urinary picture that would probably present to our healthcare professionals. But for our gentlemen, it's more of an urgency, an urge incontinence, which accounts for more 40 to 80% of what our healthcare professionals will see. This is this urging the need to go to the toilet. It's usually because the prostate gland enlarges as they get older. It squeezes on the urethra. There's incomplete emptying, dribbling, etc. So a lot of this is more to do with the enlargement of the prostate gland. The 10% of the stress urinary incontinence would be more of a neurological issue, or maybe trauma, or a side effect of surgery. So that would be probably how the picture looks. As we know, as we go into our residential homes, we see maybe 1 in 3 at least with some issues of continence issues. Our continence nurses work closely actually in these homes with our district teams, looking at ways of treating this better and more effectively. Once we go into our nursing homes, 2 and 3, and sometimes some of the homes I go into, everybody, it's just dependent on age and condition, can sometimes be experiencing continence type issues. So again, we don't know if these figures are actually accurate. We don't know. I'm pretty sure they're not, because a lot of the guys are not coming forward. I think as women, we'd chat a wee bit more between ourselves and have a laugh and a giggle about the trampoline, and laughing, sneezing, coughing. We would have more of a giggle about it. But for gentlemen, this is something that doesn't seem to be looked at just as much. And this has brought us on to a couple of different studies we've been looking at within Northern Ireland, and one of them was like an acute assessment. So actually going in, rather than ticking a box, bladder, bowel, once a day, which was a very scarce, brief type assessment, we're looking at adding to the continence assessment to make sure we're just not putting someone in a product, to make sure that we're actually treating them better. And I think one of the key times that changed a lot of our continence service was the Francis report, and I would encourage you to have a look at that. It was out of the Mid-Staffordshire Hospital, where 74% of all the verbal complaints was regarding continence care, putting a product on someone where it was not appropriate, not bringing them out to the toilet, no access to urinary bottles, etc., etc. So it's an issue that is being addressed an awful lot more, I believe. Again, 10 to 15%, and I have actually seen this myself as I've been out with the clients. When the prostate cancer is, the surgery can sometimes be quite extreme. The radiotherapy can also have side effects and consequences. Some 10 to 15% are left with persistent urinary incontinence. Now, having worked very closely with our continence leads, they can say it can sometimes take them up to 6 months to get a gentleman after prostate surgery dry. So sometimes there is a cohort of this 10 to 15% that may need something else, whether that's a containment product, a medical device product, etc. So there's always something, I think, that we can do to manage it better. And the document I'm referring to is the best practice document. It was brought out in October of last year, and it was a Nursing Times led document endorsed by the ACA. This is the Association of Continence Advice, and I would encourage you to join it if this is an area that you're interested in. Years ago it was Northern Ireland and a Dublin group. Now we're an all-island ACA group. The last meeting was in the Gibson back in February, and these are where all our best people come together and are looking at all these continence issues, usually a couple of different study days a year. I would encourage you to look at the ACA. So this document has been endorsed, and there's a lot of good information within this, and it looks at the hidden problem in men, how to address it, what a good continence service can look like. So if this is something that you would like, put a wee note in the Q&A, or send an email, lift the phone, whatever works best, and we'll get the document sent as an email or a hard copy, whatever way you like it sent out. The reason we get so excited, and TENA have employed, I think most of us out in the team doing this are all registered nurses. Good continence care will equal good skin care. I've seen this so many times over the 10 years, and Sarah, who is on with me today, has 22 years with TENA. We want good continence care. We want our patients toileted, and we want our patients, if they need a product, to be assessed for the correct product. When we get the correct product in the correct size with the right absorbency, we are going to reduce any potential damage to your skin. And tissue viability, we quite often work very closely with them as well. We want the products to take away the moisture from the skin, keep it dry, and a non-rinse cleanser to clean the skin, and this will all protect our patient's skin, and as we get older the skin becomes more vulnerable. So good continence care to me equals good nursing care, if nothing else, and never mind good skin care. Just to have a wee look at the TENA type products. Over the years I've been dandering around the wards, north and south, if you've seen me. This is one of the products that I haven't seen, I would say, enough of within the ward areas, and it's something that we have addressed actually quite a bit. It's a very specific male product with a nice design, shaped for men, thin and discreet, and not overly bulky type of product. Some of the key benefits is it's nice and thin. It locks the absorbent, super absorbent powder, locks the urine away and keeps it locked away, so keeping the skin dry. It's nice and comfortable because it's not overly bulky or anything like that. All our products have odor control systems in them, so there shouldn't be any unwanted odors. If there is, we'd be looking at something else. They all have a wee sticky back which keeps it secure to the underwear, and they're all individually packaged. Everything is dermatologically tested, so the material is nice and kind to the skin. And I just want to come off here. And you see me again, technology. Yeah, so these are the types of products that if you would like them sent out, we will send you out a copy of the booklet and a copy of the products. But the TENA Men comes in 3 different sizes. I'm aware of my screen. The level 1 is slightly physically smaller in size at 150 mils, but the level 2 and 3 are the same physical size, but the 3 takes you up to 300 mils as opposed to 200 mils. It has the wee sticky back that sticks on to good fitting underwear. And again, this is a male specific product that I think actually should be in most of our wards, because quite often as I'm having a walk around, I'm seeing more of a female type looking product, and it's just for dignity reasons. And again, these, if you want any more advice or help or to look at your protocols or what products you are bringing in, please get in touch with us and let us know. One of the things to have a look at as well is with World Continence Week, usually we'd be out with you and we'd be in the foyers of health centres. Last year was in the Matter in the foyer with the team. But this year we launched our Facebook community. So please go on and have a look there and encourage your clients as well, because we haven't got the same availability or face-to-face at the moment. We also do have our TENA net, which links us into our TENA academies. So today is really a snapshot of who we are, what we can do, how we want to help you to shape your products on the wards, to choose the right products for the right client. And quite often, one of the projects we did last year, we were actually able to save, we did 3 units, one saved 8%, 12% and 18%, and that was putting in the correct products and actually showing the staff to how to use them correctly, and that's putting in a different assortment. So we do a lot of work on the wards as well. So yeah, that's sort of where we're at. I'll go back to you, Maeve. I don't know how we are with time.
Thank you very much. Some incredibly interesting facts and figures there and lots of food for thought. I hope everybody enjoyed that session. I'm now going to ask if anybody would like to partake in the question and answer session. As I say, there's a bar in the centre of your screen. If you hover over, you'll see a little box saying show Q&A. If you bring that up, it will you can just type in a question there. But I understand if you don't want to put up your question on the session today, that's absolutely fine. If you'd like to email us after the session, we'd be more than happy to answer your questions like that as well. Also, just to say that, as Janice mentioned, anybody who's attended our webinar today will be receiving a copy of the excellent best practice document, which I think is really good reading for everybody involved in this area. And also, we're going to send you out some samples of the products just to let you have kind of a feel of them as such. And we'd be delighted to offer you further service when it comes to those products, as Janice said, to streamline your products and help you and your team manage your continence wear throughout your hospital setting, or be it in another setting, in a nursing home, or whatever suits. Okay, so I'll just check if there's any questions coming in. Not yet. That's no problem. So just for while we pass the next minute or so, to reflect on Jamie Gaines' story, as Janice referred to in her presentation, you know, the key to male, I suppose, health when it comes to incontinence is the referral pathway. Well, that would be for everybody suffering from continence issues, and the issue that is quite obvious, as Janice pointed out, only 22% of men are actually coming forward to say that they have issues. So it's really to make this subject no longer a taboo subject, and to get it out there and allow men be comfortable in this space to come forward with if they have any issues, to present as early as possible, because the reference that you had for one of your trusts, Janice, was incredible. Mm-hmm. The curing rate at 98%, I think that's outstanding. And this obviously, I'm sure the same across the board. We just don't have the figures to hand, but I'm sure that's the same across the whole island. So that's really reassuring, I think, to patients to hear those type of facts as well. So thanks for sharing that, Janice. So just in the interest of time, we might actually just wrap up the session, because I'm keen that everybody's taken time out of their busy schedules today. I'd like to say a huge thank you to everybody for attending. Really appreciate it. And as I said, we'd be delighted to send out some samples, and also to send out the best practice document to all who've attended today. We also will be running another session. So just to let you know, in August, we're planning for August 11th. We'll send you out the details of that in due course. But if there's anything at all you'd like us to help us with in the meantime, or any questions or queries, please don't hesitate to drop us an email or pick up the phone to myself or Janice or any of the team. Thanks again for attending. Really appreciate it. Take care.